Hello, today I'm going to introduce you to the Avazzia BEST RSI. BEST stands for Biofeedback Electrostimulation Technology and RSI stands for Repetitive Stress Injury. The device is fairly simple to use and I'm just going to talk you through it now. So if you have a look at the back, you will see the electrode and also the battery compartment. It's two AA batteries. The devices come supplied with the first set, and you don't need to replace them that often. On the side is the on-off switch, and on the front is the programs and the sensation to the electrode, which comes in a plus and a minus button. So first of all, we're going to turn the device on, and then we're going to set the power to the electrode. And to do that, you need to place the electrode firmly against the skin, and it is slightly angled, so make sure that it is firmly against the skin, and then push the plus button till you can feel a sensation. There are two sorts of sensations. One is comfortable and one is tolerable. The comfortable is what we use most of the time, and that is just so you can feel the sensation, but it isn't biting. The tolerable one we use for acute sports injuries. If someone has just injured themselves and the pain is really extensive, then you can place the device on there and push the plus button until they can feel the electrode more than they can feel the pain from their injury. So we have now power to the electrode. Now we need to go into the program section. The center button here is what controls the different programs and how we get in and out of them. When the device first comes on, it comes on in the relaxed program, which is the first one we're going to use. So we can place the electrode against the skin around the area of pain, and you can spend 2-3 minutes working by just lifting it and placing it, lifting it and placing it. And you can move it backwards and forwards if you want to. You will find after that the pain has been reduced, and one of the things that we do suggest you do is ask your client first, what is their vector of pain, what is their level of pain on 1 to 10, 10 being the highest, what is it before the treatment start? And then after that first treatment in the relax program, you can ask them, what is the level of pain now? We usually find that it goes down from their 8, 9, 10 down to a 5 or 6 after that first level. It not only gives us an idea of the dynamics of the machine, how the patient, the client's body is working, how it's progressing, but it also gives the client an idea of what's happening within their own pain levels. So then after you've done the relax program, you push the center button again and you keep going around until you can get it onto the acute section. Then you're going to take the electrode, place it back. By now you've usually got a reduced area of pain, so you can go into the reduced area, place it on that area and wait 1 or 2 minutes. After that, take it off, ask them, what's your level of pain? You can move it backwards and forwards at the end of the treatment as well. So say now their pain has gone down from their 5 or 6 and it's gone down to a 2. So we're nearly there, but we're just going to do a little bit more. You have 2 other programs you can use. One of them is the deep stimulation, which we use for everything other than a repetitive stress injury. So if it was carpal tunnel, we'd use a repetitive stress injury. If it was anything else that is not a repetitive stress injury, then you can use the deep stimulation. You do exactly the same as you've done in the relax and the acute. You push the mode button, you pick the program that you want, you place it back on the area of pain, you hold it on for a little while, and you move it left to right, up, down. When you're moving it up and down, left to right, you will feel sometimes areas of stickiness. You keep going until those areas disappear. So that basically is the very simple way to use the device. If you want more information, please go to the American Carpal Tunnel Institute.com website and you can read more about it. Thank you.